It's a cold, beautiful Saturday in the city of Lagos. This is Contraceptive Matters with DKC Nigeria. I'm Olasunbo Modupe, and this program is basically brought to you by DKC Nigeria, one of the largest and private providers of contraceptives and reproductive health products in Nigeria. And what we do on this platform is to encourage families to make smart choices about child spacing methods, STDs prevention, that's sexually transmitted diseases, and as well as reduce maternal mortality rates in the country. Last week, we actually addressed questions from inquiries from the DKC's RHS platform. That's our short code platform. But this week, we are doing something different. We are looking at another form of contraceptives, another form of child spacing method known as contraceptive injection. And I'm not alone in the studio. The program continues in a moment. Please stay with us. Make yourself comfortable. We'll be right back. Welcome back. It's still Contraceptive Matters with DKT Nigeria. And like I said earlier on, we are looking at another form of child spacing method today, contraceptive injection. And we'll be looking at its components, what makes it different from other child spacing methods. I'm being joined now by two beautiful guests. Our doctor in the house, Dr. Tosin Laleye. She's sitting right close to me. Welcome to the program, Doctor.
Thank you very much.
And,
good afternoon, everyone at home.
And regular face, Omolara Aluko. She's the Media and Communications Manager with DKT Nigeria. Welcome.
Thank you very much, Simbo. Good afternoon, viewers at home. It's actually a pleasure being on set once again.
Okay. So we are looking at contraceptive injection today. What makes it different from other form of contraceptives?
All right. Thank you very much. The contraceptive injection we are talking about today, the brand of DKT is Sana Press. Okay. It's different from others because we say it's an improved version over the others, and we say that because due to, excuse me, due to several tests and all of that have been going on, we've actually been able to reduce the amount of the active ingredient in it, and that means that you have less side effects from it.
Okay.
And then another reason why we say it's different and better is the fact that it comes pre-packed with a very small needle to administer it. So that way there's reduced pain. So that's why we say it is better. So the Sana Press is an example of a progesterone-only contraceptive. The active ingredient being the medroxyprogesterone. It's taken every 3 months, and it's actually very comfortable to use.
Okay. What do you mean by hormonal? And can you please let members of the public, the viewers, know the difference between hormonal and non-hormonal? Because she just reeled out some medical terms now, the progesterone and all that.
Yeah, there are two very important hormones in a woman that are important for reproduction and like everything that has to do with reproduction in a woman, that's the progesterone and estrogen. Those two hormones, they are very, very important for the reproductive system of a woman. So that's what we mean by hormones. So most of the time, a lot of the contraceptive methods we have are targeted at these hormones because they are the ones responsible for pregnancy in a woman. So that is why most of the contraceptive methods available are targeted towards these hormones. So the non-hormonal methods are the ones that have nothing to do with these two hormones I've mentioned.
And it can't alter, that means it can't alter your system, body system, if it's non-hormonal.
Well,
we're talking about not altering the body system.
Because some will tell you, because I'm on implants, I'm on IUD, and I'm on so form of contraceptive, I've added weight, experiencing 1 or 2 changes.
Okay, well, talking about those changes now, sometimes we usually say these changes are perceived. You get it. There are some changes that are not necessarily associated with this with this particular method. We usually say for even the hormonal contraceptives now, the hormonal contraception, that what you get in terms of change, talking about the body weight, are slight changes. And the changes are not necessarily that you're adding. It could be that you shed some weight. Then talking about, hormonal changes in the system. The way it works, to some extent is that because these things are strange to the system. It takes the system a little while to adjust to it. The same way when a woman is pregnant, the same way it takes the system some time to accommodate, that new thing that is happening in you. The same way it happens with hormonal contraception. But once your system gets adjusted to it, they work together very well to do what exactly is meant to do in your system. Okay,
so doctor, do you want to add something to that?
Yeah, and just to further emphasize what she said, you said something about altering the body, and then she's explained that it takes the body a while to get used to the changes. And that's because, the normal thing in the system of a woman is just, okay, once you meet with a man and all of that, it is to get pregnant, as in. But if we leave the body like that, I wonder how many babies one woman will actually have. So that's why the contraceptive is the normal thing for the body to do. And that's why we menstruate every month. The womb gets ready to be pregnant every month. But we both know that the woman cannot always be pregnant.
Okay.
So that is why it is very necessary.
Okay, so how does the contraception work, the contraceptive injection work?
Okay, like I said, the contraceptive injection is taken once every 3 months as long as the woman has been confirmed not to be pregnant. So the way it works is that there's something we call ovulation. Ovulation is simply the release of the egg from the woman's ovaries. So this contraceptive injection works by delaying ovulation. That's, it will not allow for the egg to be released. If there is no egg release, there will be nothing for the spermatozoa to fertilize. And then it also works by altering the mucus secretion from the cervix, so that it makes it thicker, so that sperm will not easily swim in to fertilize the egg in case an egg is released despite the contraceptive.
Okay, so who can use that form of child spacing method, and irrespective of age or health condition?
Okay, talking about that now, we'll look at the fact that I will start by saying that if you are a kind of a woman that is busy, you know, we have these busy schedule. I want to be here, I want to be there. You get it. So if you're a woman that you're busy, you don't really have the time. You are the type that is forgetful.
Okay.
You can't remember to take the daily pill. Then I'll say this Sana press is actually good for you. Then, you know, talking about because we've been having a series of people ask questions that, okay, I am a breastfeeding mother. Can I take this form of contraception? I will say that for Cyana Press, even if you are breastfeeding, you can take it. But please make sure that your baby is up to 6 weeks. After 6 weeks, you can go to your healthcare provider. You can, you know, discuss with them, and you can get this form of contraception. Now, talking about and if you are healthy, you can take Sana Press. It's a good modern contraception for you. So now talking about those that cannot use it, I would say that if you have a severe hypertension and it's uncontrolled, you know, there's some kind of hypertension that when you have it, you know, is under control in terms of you go to your doctor regularly. There are some drugs you are placed on. So if you have uncontrolled one, please, you cannot take this particular contraceptive injection. And for people that are obese, that have this condition, obesity, you know, that are all, you know, on the extra large size, very big set of people, you cannot take this method of contraception. And in case you also you've been diagnosed of one heart condition before, I would say you cannot take it. Yes, you cannot take this method of contraception.
Okay, so doctor,
sorry, in addition to that, if you are diabetic too, you are not advised to take.
Why?
It's been found out that the thing about it is that for diabetic patients, most of the conditions she earlier mentioned will also be present in a diabetic patient. For example, hypertension and diabetes, two of them, they tend to go together. Most likely someone that is diabetic will also be obese or will have a tendency to be obese. So it's generally not advised that they should take this method.
Doctor, please take us through the mode of administration now. For instance, some people might complain. You said it comes with a fixed needle already. Some people might be, you know, have this fear for needles, not to talk of it pricking.
Okay.
So what's the mode of administration?
Yeah, the good thing about it, like I said before, it comes pre-filled in the pre-filled chamber and with a very short needle. So the needle is such that because it is short, like I said, the injection just goes a little bit below the skin. We call it subcutaneous. Just like diabetic patients that give themselves their insulin the
shots.
Same way insulin is administered. That's how it's done. So it's not an intramuscular injection. It doesn't penetrate deep. So even if you are scared of needles, you're not going to feel so much pain because it's not going so deep. It's not going into the muscle. So it will not be very painful. And it's something you can learn to administer yourself. So after a while, you may not need to
So there is no special instruction.
Well, in terms of our administration, we'll still say that, you know, because, you know, here in our part of the world, we so much like to, you know, do some medications and things like that. But for this particular contraceptive injection, you have to visit your healthcare provider, visit your nurse, your doctor, that are trained to administer for you. So what they do is, you know, like the doctor has described the administration, once they bring out the Unijet, talking about the single dose. A single dose. That's the syringe with the needle. It actually comes with the contraceptive injection in it. So what they do is, once they bring it out, they shake it. You understand? And they actually they activate it. So we can see it going on our screen, the process of activation. So they activate it, and once they activate, you can either take it on your thigh or on your tummy, either of the two places. Okay. That's where the nurse or the doctor will administer it for you.
And how many times is that content alone? How many times can you use it? Is it just
no?
Once?
It's just a single. Yes, it's
shot,
a single dose,
it's a single shot.
Yes,
okay.
You take it once it is administered. It is not too much and it's not less. You get it. So it's just one is for you, and after using it, the Unijet is discarded because there's nothing in it again. There's no content in it again. So the issue of having a reused needle doesn't come in place. The issue of having too much to take or too little doesn't come in place. So you get exactly what you want, that gets you protected for 3 months.
Okay, I was going to ask you the expiration. How long does that last?
It stays 3 months in the system.
Okay. It's still Contraceptive Matters with DKC Nigeria. This is to let you know that we've been discussing contraceptive injection. And you can also join the conversation. You can send WhatsApp, just WhatsApp on 0809-027-9018. 0809-279-018. Please do not call that line. Do not call that line. It's just WhatsApp only. Let's move forward. We know it's a form of contraceptive. It's a form of child spacing method. Aside from that, what other benefits do I get from adopting contraceptive injection?
Okay, well, I would say there are lots of benefits you get from it. Number one, I would say is discreet. You know, in this part of the world that, you know, to some extent, people are not still very open about contraception and things like that. Okay. For this contraceptive injection, once you take it, it's in your system, nobody can know you have a method. And now is another method that, you know, you don't have issues that says, oh, my partner will know I have this method. It will be touching my partner, like some people believe. Like
complaints about the IUDs.
The IUDs, yes, that it interrupts their intercourse when they're having it. You know, for this particular one, is not something that happens like that. You take it, you are protected. Then, like the doctor earlier shared, you know, is low dose, meaning that, you know, unlike the previous 3-monthly contraceptive injection that we have before now, that you have so many, you know, women complaining about some side effect. But with this contraceptive injection, this Cyanapress, you know, you have less of that. You have less of it, less of side effect. And also, you know, looking at it, the fact that you even get protected for 3 months. For 3 months, you are not running to the clinic for checks. You are not, you know, forgetting your pill. You have it. You have this peace of mind. You have this freedom to do what you want to do with your partner. You have less, you know, one less thing to worry about. Then the fact that it's also the administration process is less painful. We can see, you know, when it was shown on our screen, the needle is very, very tiny. So you don't have the issue of, oh, the nurse is asking you to raise up your dress, to turn your back, so let me, and you are like, nurse, will it pain me? Doctor, will it be painful? You know, that one is not out, you know, that one is out of it. So you're giving it subcutaneously on your thigh, on your tummy, and off you go. Okay.
It has so many benefits. Yes. Is it pocket friendly?
Yes.
Is it pocket friendly? Because it has so many. It has so many benefits. It is mobile. No, our viewers need to know. Our viewers need to know.
Like
it is. I'm not an Ijebu, but Our viewers need to know this. Is it pocket friendly? Is it
Yes,
affordable?
Very,
yes.
very pocket friendly.
Very pocket friendly, very pocket friendly. Talking about, you know, depending on, you know, we usually say this, that depending on where you stay, where your environment is, this particular injection you can get from 500 naira to 1,005.
Okay.
Yes, and if you could get that 500 to 1,500 for 3 months, I think that's a good deal.
Okay, our messages are coming in already. Someone sent in the message, I am fat. Can I use Cyana Press?
Oh, fat will depend. The fat now is relative.
I use size 10, 12, 14. Being fat could be size 14, 15, or 16.
Okay, well, what I would just say is that, like we said, that for an obese individual, it's not recommended. And for you to find out whether you're obese or not, you need to visit your clinic. The doctor or nurse will need to calculate what we call your BMI. By checking your weight and your height. So when that is calculated, if you fall within the range of obesity, then it's not advised that you use Cyana Press.
Okay, please, I have a question for the doctor. I have been taking pills, combination 3. I don't know what she means by that, for about 5 years now. My question is, can I swap to injection? My husband wants me to stop because he believes that that's why I'm not fat.
Oh my God! Can you see different strokes for
different
people?
folks? But you know, we said that change in weight can either mean increase in weight or a decrease in weight. Yes. But then, well, I wouldn't know how you were before you started using the pill. But if there's nothing that says you cannot change a contraceptive method, so if you feel you want to move from a particular method you are on, there's no problem with changing, but you just need to visit your clinic, let the health personnel there see you and counsel you appropriately on the new method you want to adopt.
Okay.
You should be fine.
The contraceptive injection, I hope it won't work more than 3 months.
Okay. Now, that will depend on what this person really wants. Because if you are taking it, it works for 3 months actually. It's meant to work in your system for 3 months. But in case this particular, the particular person that sent this question doesn't want a method that will last more than 3 months, then I want to say that the person can go on daily pill. Because with daily pill, it's easier for you to stop and to get pregnant immediately. Yeah, because with contraceptive injection, you know, you have like a range of 2 to 6 months, you know, your system returning back. But if in case after 3 months, you want to instantly, you know, return to fertility, we will advise that you go to your doctor, speak with them, ask varying questions about a daily pill, and they can counsel you. But the truth is, for contraceptive injection, if you've been on it for a long time, it takes like 2 to 6 months for your system to regularize back.
Okay, well, it's still Contraceptive Matters with DKs in Nigeria, and we have been discussing contraceptive injection with the help of Omolara Aluko, the Media and Communications Manager with DKs in Nigeria, and Dr. Tosin Lale, our medical expert. Contraceptive injection is a hormonal form of child spacing method. It is painless, it is easy to use, and it has the lowest dose of progesterone. I got that from the doctor. It has the lowest dose of progesterone. So when we return, we'll open the lines. I'm sure viewers are willing to call our guests to find out 1 or 2 things about the form of child spacing method. So please stay with us. The program continues in a moment. Welcome back. It's still Contraceptive Matters with DKT Nigeria, and today we are looking at contraceptive injection. We have been discussing the types. We have just one type, which is cyanopress from the stable of DKT Nigeria. We've been discussing how to manage some of the side effects, how to use, and who can use it as well. And viewers have been sending in messages. You can also call if you need one or two information about this topic or any other form of child spacing method. You can log on to www.onionbanana.com, www.onionbanana.com, or send your question to RHS space 38350. You can do that by spacing, typing RHS, your question, to 38350. Viewers at home, you can also join the conversation. Share your thoughts with us on 0908-729-6673. 0908-729-6673. Please, when you're calling, reduce or turn down the volume of your TV set to the lowest, please. Turn down the volume of your TV set to the lowest. Let's go ahead to the side effects.
Okay.
Are there any side effects, and how can they be managed?
Okay, definitely there are side effects. Yeah. So, well, the first one I'll talk about is headache, just minor headaches. Like we explained earlier, it takes the body a while to get used to it. So some people may complain of mild headaches, which can easily be taken care of using over-the-counter analgesics. And then we talked about change in weight earlier. The weight could actually mean an increase in weight or a decrease in weight, but not something so enormous. Just about 2 to 3 kg over the period of 1 year. So, and also, some women complain of bleeding in between menstrual periods. Usually it's spotting. You may just see it. That's also a side effect, but it doesn't take too long for that to resolve. And then another one is what we call amenorrhea. And amenorrhea is absence of menstruation. Some women say they do not see their menses at all once they are on this method. For some, it comes back after a while, but some complain about it persistently. But what I just want to emphasize about that is that even...
we have a code.
Okay.
Please hold your thought. Hello, good afternoon.
Yeah, good afternoon, ma'am.
What's your name, please? And where are you calling from? Welcome to Contraceptive Matters.
Okay. My name is Joy. I'm calling from Ikotu.
You're calling from Ikotu, but I didn't get your name.
Joy.
Joy. Okay, Joy, what's your question?
Okay, my question is, I can remember last 2 years I took the injection. For like 3 months, I didn't see my period. So I went back to the health center where I took the drug. So they told me there is nothing wrong with it, that I should leave it. Then after extra 3 months again, I didn't see it. So I went out there to go and complain. So the doctor now told me there's a pill they write out for me to buy. Then after I took that drug, I bled for like a month.
For like how
So
long?
that's why he said for a month.
A month.
Yes.
Active bleeding or just spotting?
It was just coming as a floating every day for a month.
Okay, is that all,
So that-
Joy? Is that all?
Hello?
Is that all, Joy?
Yes, so that's why I stopped it. So this one that you are talking about, if I was to take it, will it still be the same way former one that I took?
Okay, doctor, can you
Thank
please
you.
quickly respond to that?
That's just what I was talking about. The truth is that some women who have amenorrhea and then maybe after 3 months or more, the menses returns, but some women will have it for much longer than that. But what I just want to say is that if you don't see your menstruation at the end of every month, it's not a disease. It's not like the blood is piling up and storing up somewhere. So some women I know actually like this method because it doesn't make them menstruate. They like the fact that I don't need to wear sanitary pad for so number of days every month. So it depends on what you want. If you are the type that it's important to you to see your menses every month, then if you get on it and you see that it's making your menses stop, then maybe you should opt for another method that will not do that.
Okay, can you please go ahead with the the side effects?
Yeah,
How
okay,
to
that was
manage the side
actually,
effects.
yeah, that was the last one I was talking about.
Okay.
Yeah, the amenorrhea. So I've talked about headaches, change in weight, intermenstrual bleeding, that's spotting once in a while in between, and then amenorrhea, absence of menses. Okay.
Hello, good afternoon.
Hello?
Hello, good afternoon. What's your name, please?
Hello?
Hello, good afternoon. We can hear you. What's your name?
Hello, my name is Oluwaleru.
Your name is
Oluwaleru.
Oluwole. Okay. What's your question? Oluwole, go
Hello.
ahead.
My name is Oluwale.
Please go ahead with your question. We can hear you. Oluwole, are you there?
Yes, I'm there.
Okay, please go ahead. We have lots of people trying to call in. What's your name? Go ahead with your question.
April or 11, I collected Hello?
We can hear you. Go ahead, Oluwole.
Please, I collected Diana Press April 11.
Okay. Oluwole, I'm afraid we have to let you go.
I collected Diana Press April 11.
Okay.
So, and it got expired July 11.
Yes.
Okay.
Then during that period, I did not menstruate at all. Hello?
We can hear you. Is that all?
No, it's not all. I want to ask questions.
Please go ahead with your question, Oluwole. Go ahead with your question. I'm afraid we have to let you go. Go ahead with your question. Please, once you call in, before you call in, gather your... Oluwole, please, we have to let you go. Before you call in, please gather your thoughts. You have to be brief because we have lots and lots of people trying to call in as well. So please go ahead, Lara.
But Oluwole can still actually send a message
SMS,
to the WhatsApp line.
WhatsApp.
Yes, please, you can send your message because she was saying she took Diana Press. I'm really interested in that question.
So Oluwole, you can send your WhatsApp message to 0809 027 9018. 0809 027 9018. Please, you have to be brief when you call, please. So go ahead, Lara.
Okay, so, you know, for most of the time, maybe we need to understand the way some of this hormonal contraception works. You know, the truth is when you take some, you get it.
Okay.
The first thing that happens to you is the fact that you don't menstruate. And that's the mechanism of action. That's the way, you know, the essence of this contraception being in your system is to actually prevent the natural process that the system goes through. That
Lara, please hold your thought. Hello, good afternoon. What's your name, please?
From my papa.
You're calling from Mapapa. What's your name?
Blessing.
Sorry?
Blessing.
Blessing. So, Blessing, good afternoon. Go ahead with your question.
Okay, my question is, I did an implant, the implant of contraceptive, but I found that I'm having, like, my period should be like 1 month before, as in, consistently, sometimes 2 weeks, after a week, I'll still get, see my period. So I don't know.
How long have you been on the method?
It is 2 years plus.
2 years plus. And during these 2 years, this is what you've been experiencing?
Yes. Initially, the first time I went to my health provider and she now told me that maybe my body will adjust. That if I want to remove, the only one that I have to put is the IUCC, and it's the same. They work hand in hand. It's just the same thing.
Okay.
So, and since then, I've been seeing my period like 1 month.
You have not seen or you are still seeing?
I've seen my period like 1 month.
Okay, normally the way it should be.
Up to 1 month.
So is it continuously?
For a month or every month?
Blessing, please. The menstrual period now, is it every day for 1 month, or you do it few days, it stops and it comes back?
Like the other regular cycles?
No, like maybe this one should be 1 month. Maybe the other month I might not see. The other month I'll say like 2 weeks. Then after a week I'll see my message will still come like 3 weeks.
Okay, Blessing. Now, if I may ask, your pad, is it usually filled or they are spotting? Because we need to understand the difference between spotting and menstruating. So the question is it spotting, something that just drop in your pad? Your pad is not half full, neither is it full. Which one now?
Like, okay, let's say for the first week will just be like spotting.
Okay.
Then the next 3 weeks, it will be like normal flow. It's not heavy.
It's not heavy.
But 3 weeks, I'll see my normal menses.
Okay. And you've been to the hospital? The doctor says what?
The doctor said that my body system will adjust.
We adjust
Initially,
to
they
it.
give me pills that for like is this 3 months, so
Okay.
that it will correct.
Okay.
So
Then-
after the 3 months, it was okay. Like after that month, the next month it still continue the same way.
Okay, thank you, Blessing. We'll respond to your question now. We'll
Okay,
respond
can
to
you
it.
quickly respond to that briefly?
Okay, well, if I understand her correctly, well, what I didn't get is the menses now regular or is it still irregular? I didn't quite get that from what she said. But the thing is, like she said, the implant is also another type of progesterone only contraceptive. So it is hormonal. So it is normal to see spotting. It is normal for there to be disruptions in the menstruation. And like she was told when she went back to her healthcare provider, it takes a while for the body to adjust. And after a while, it regularizes. And then in individuals in which it doesn't regularize, the doctors can actually prescribe a medication that will help regularize the menstrual cycle.
So,
Okay.
Blessing, if you are listening to us, you can actually send a WhatsApp message to the line that Sumbo has given out.
Yes,
She will
the
still give out the
comprehensive
number.
one.
So you can send a WhatsApp question
Number.
to it, and our medical doctor will respond to you. There are some things you can do. Then please let me say this now, that for women, we need to understand the difference between spotting and menstruating. Then we need even also to understand what we mean by heavy bleed. Because you know, sometimes when women come on here and say, oh, I'm having heavy bleed, what do we mean by heavy bleed? Do
think
you
you
get
should
your
shed more
pad?
light on that.
Yes. If your pad gets filled up within 30 to 1 hour, that is heavy bleed.
Okay.
Spotting
And like how many pads in a day?
in a
I
day.
think that will help
If
as
you
well.
start moving from
Maybe three, 4 in a day to 6 to 8 parts.
then we say you are having heavy bleed. Then also spotting are things that are normal to some extent. Let me put the normal in quotes now. When you are on hormonal contraception, and please, spotting doesn't mean you are menstruating. Yes, because you know, for her, she said spotting for just when you hear she menstruated for 1 month,
Yeah.
you'll be
Yeah.
afraid. And that was why we asked that, is it spotting or is it normal regular period? Then some of them is just 2 to 3 days they menstruate, and the others will be spotting. That is not really heavy bleed.
Okay, so let's get some messages now from our WhatsApp platform. I do have menstrual pain. What can I use? And I have heavy flow.
Okay.
Okay. There are, first and foremost, if I was talking to you, there are questions I will ask you. For example, have you always had the menstrual pain right from when you started menstruating? Because if you had it from the beginning, then okay, my heart is at rest. I'm not worrying about maybe it's something else. But if it started maybe years after you had started menstruating, I would just say you see a doctor, because there are a lot of reasons why you have heavy bleed and painful menstruation. An example of them is if you have uterine fibroids, it can happen. I'm not saying you have fibroids. I'm just saying it's a possibility. It can cause heavy bleeds and it can make you have cramps. So you need to get yourself checked out to know the reason why you are having that.
Okay, I have never done family planning before, but since my second child, although through CS, that's the cesarean section, for 26 months now, pregnancy has not taken place. We don't even protect ourselves. What could be the problem?
Well, you've never used contraceptive and, okay, well, I want to believe you're having sex regularly. When a couple is trying to get pregnant, we actually advise sexual intercourse 3 to 5 times a week. That's what we recommend
daily.
for them. So,
No,
well,
you need to be explicit.
You said daily.
It's
It's
yeah. Good luck if you can do that. So
Okay.
it's not something I can just answer on there. You will need to see your doctors. So if you've been trying to get pregnant for 26 months, that's a long time, and you're not getting pregnant, please, you need to get checked out.
Okay.
Then please, for that woman also, you know, the issue of conception is not just a woman thing. It's something that has to do with both the man and the woman.
Okay.
So please, when you are going to the hospital, go with your husband so that both of you can present yourself for some examination to actually know where the problem is coming from.
Okay, is there any name for contraceptive injection in case we want to buy from the shop?
Okay, the contraceptive injection is called Cyana Press. Cyana Press, it comes in a rectangle white and blue box.
Okay.
Cyana Press is the name.
Okay, what can be done to prevent skipping the injection?
Okay.
Because there's no, we are humans.
We are human, we can forget. Okay, that's why for us at DKT, because we want to ensure that you don't forget and you don't get pregnant on us. So what we'll do is immediately you get your first shot of Cyana Press at the hospital, at the clinic, whichever way, you actually type SAP on your phone. That SAP is a short code for Cyana Press, and you send it to 38350. Type SAP on your text message platform, send to 38350. It's actually free.
Just as the average.
Yes. So you get an auto response that says, welcome Cyana Press user. So a week to the expiration of your first 3 months that you took the injection, you will get a reminder alert from that 38350 telling you that your Cyana Press is about to expire. Please go for another shot. And a week after expiration, you still get another reminder alert from this 38350 reminding you that it has expired. Please go for another injection.
Okay, I think we have a call now. Hello, good afternoon. Hello, good afternoon. What's your name? Welcome to the show.
Thank you.
What's your name, please?
My name is Mrs. Oguntimei.
Oguntimei, Mrs. Oguntimei. Please go ahead with your question.
Yes, please, I want to ask a question.
Okay.
Yeah, I'm on Implanon for over 6 months now.
Okay.
And I keep spotting. And I've seen my doctor. My doctor said I shouldn't bother. But it's bothering me.
Okay, thank you, Mrs. Oguntimei.
Thank you. Mrs. Oguntimei, the doctor is actually correct by telling you not to bother. Okay. You just got it less than 2 months. It's what's happening is it takes a while for your system to adjust to it. You know it's new. It's not in the system before now. So please, like the doctor has said, take your mind off it. Don't be bothered. That's the mechanism of action. Because it's new to the system will find a way, one way or the other, to react to it. And that's your system reacting to it. But over a period of time, your system adjusts to it and you don't get that. Because most of the time with some of these implants, what you see more is no bleed at all. That's yes, no bleed at all. I'm actually, for Mrs. Oguntimei, for you to have peace of mind, I am myself is actually on Implanon and I'm fine. So please, if you can take your mind off it, you will enjoy the method.
Okay, briefly, how long does it take a CS person to conceive? I think you have to be brief on that. We just need to take that.
There's no hard and fast rule, but generally we say at least someone that's had a CS before you get pregnant again, a year at least.
Okay. Your final thoughts, because we have to leave now.
Okay, so basically Cyana Press is a contraceptive injection that you are a busy woman, you can adopt, you get protected for 3 months, and it's less painful. It's affordable and it's effective.
What about you?
Okay, well, I'll just need to reiterate something on what I just said. When we say a year, it doesn't now mean that if pregnancy occurs before 1 year, you have to go and abort it. No. But it's usually what we advise. Okay. But if it happens, just make sure you see your doctors on time and let them know.
Okay, that's the show this week. It's been all about contraceptive injection today. But that's not all. Before you adopt that style, that form of contraceptive, don't say because you've had a first-hand information on the show today, you go ahead to adopt that style. Seek medical help from your doctor. Seek your spouse's consent before you adopt that style. I'm Olasunbo Modupe. Thank you so much for watching.